Arthritis is the most common cause of hip pain and disability, and a new hip can often restore movement.
Now, in 2011, there were 512,000 hip replacement procedures done in the U.S. Shelley Bota tells us about one type of replacement surgery that has patients back on their feet faster.
With traditional or posterior hip replacement surgery, surgeons go in along the side of the hip and curve along the back side. But there is another choice, anterior hip replacement, where surgeons go in through the front of the hip.
And I love playing golf.
Gary Hagbert has always been an extremely active person, refereeing high school football, baseball, and more.
I was playing softball 2 nights a week, playing golf probably 3-4 nights a week. Many times the wife let me out of the house, I was out playing golf.
But chronic hip pain beginning in 2010 took him out of the swing of things.
When I tried to do anything, softball, golf, anything, I was having so much pain where it would lock up and it was a sharp pain.
Gary tried anti-inflammatory drugs and cortisone shots, which worked for a while, but in 2014, the pain became unbearable.
I didn't want to be a 50-year-old man walking around like a 70-year-old man.
Gary turned to orthopedic surgeon Dr. Mike Schnabelt at Aurora BayCare Medical Center. Gary was diagnosed with end-stage osteoarthritis in his hips.
End stage is when the arthritis is at its most progressive stage. It's basically bone on bone. There's a lot of inflammation around the whole joint.
Gary needed both hips replaced. He chose to have the anterior hip replacement instead of the more traditional posterior approach.
The first 6 weeks in particular, having your hip done from the front or from anterior, the recovery is much quicker. There's also much less pain. The incision is smaller. It's a much more direct approach to the hip. And the beauty of it, we don't have to cut any muscle at all.
Dr. Schnabelt says other advantages include better x-rays and more.
Getting better x-ray images during the surgery allows us to put the implants exactly where we want them, which is better for the patient and for the longevity of the implant. They last longer the more accurately we place them. It's also much easier to get the leg lengths for the patient back where they belong.
And a patient can get both hips done at the same time like Gary did.
You'd never consider doing that with a traditional posterior hip replacement.
Within days, Gary was up and getting around.
I was back to work in 2 weeks.
By summer, Gary was back to coaching and playing ball. Plus, his swing is back to where it used to be. Although whether that's good or not depends.
Golf game is no better than it ever was, but I don't have the excuse now. I had the built-in excuse, my hips hurt. So my handicap stayed the same, but yeah, I wasn't in any pain.
Dr. Schnabelt says Aurora BayCare doctors perform the most anterior hip replacements in the region by far. To learn more, you can call Aurora BayCare or email healthwatch@aurorabaycare.com. And that's your Health Watch. I'm Shelley Bota, Local 5 News.